Piers, you've been in this wonderful position of, and probably really tough positions from the discussions that we've had over the last 20 years of your career, having taken 5 companies through IPO, raised over $1 billion, $1.5 billion. So you must have seen the good, the bad, and the downright ugly of biotech.
What was interesting during the pandemic was that the fundraising, company formation, listings, and everything, as we all know, went through the roof. And I think what we're now seeing is the reset from that, as companies that got quite were going public at quite an early stage. Clearly, the IPO window is now completely shut. There's a lot of money still to invest, but investors seem to be sitting on their hands to a large extent. Potentially, the deals which are being done seem to focus quite a lot on the companies that may have been getting incubated, so you're seeing maybe a smaller number of deals, but some quite chunky numbers being raised, but that's not feeding through into the more general population.
Yeah, you were mentioning it. This might seem like 2003 all over again. I remember there were some data science companies around then that were trying to do all this as well. So, and I'm kind of wondering what has have we really learnt?
There is a lot of European money that is interested in that convergence of tech and biotech, which again is something which was maybe around in 2000, 2003. But I think you're right. I think the AI will become a standard tool in everyone's armory, but which approaches may be more than just a tool, but actually truly radical and innovative in themselves.
The Inflation Reduction Act is now upon us. I'm not seeing many people really be worried about it.
If it's a one-time hit, I think it doesn't have too damaging an impact on the sector, and I think that's where people are currently seeing it. But if it becomes a political tool that gets used multiple times, then it's clearly going to erode the capacity of the sector to generate returns for investors. So I think the other question I've seen is, will Europe respond? Will the UK respond? There's certainly political noises about it. I wonder how truly affordable it is for the UK to come up with anything meaningful in response.
There seems to be a pullback, particularly in terms of these advanced therapies, and there seems to be a renaissance of small molecule companies, believe it or not. How are you seeing, from an investor's perspective, that where they start to look at new opportunities that can generate actually the returns for their investors?
So I think that's an interesting conundrum, if you like, for the investor space, as to do they then start to move more generally into areas they're perhaps less familiar with, but where there's maybe better chances of success, both in terms of products that can get to market, but then also the positioning they can establish.
If we look at the fact that a COVID vaccine was effectively approved for emergency use in the space of 18 months, are we really seeing how you can fast track the development of needy medicines rather than taking 10 years to something that's closer?
Yeah, I think it certainly showed that the regulators can be creative and supportive. But I do wonder. I think their bias will be to revert back to being safety first.
There's a trend over the years. What I've seen is, as the companies become more late stage, they gravitate towards the US.
Yeah.
You would have seen this in the companies that you worked with, to find the leadership over there that can help essentially commercialize those assets. Are we saying that there's still a bit of a gap in Europe in terms of those skills and capabilities?
I do think there is. I think it becomes a bit of a self-fulfilling state of affairs. The companies, as you get to mid-stage, you need more money.
Yep.
You gravitate over to the US because that's where the money is. The trials are run there. Everyone's focused on getting a US approval. So I think a lot of the late-stage clinical regulatory CMO expertise still sits more weighted towards the US, and that's maybe a bit of a skills challenge, a skills gap within Europe.
There's always been this conundrum in Europe: where is the leadership? And it's still today. And the question that we've been toying with many, with the investors and the companies is, how can we nurture tomorrow's leadership?
There are probably one or two key hires that are always going to be most likely to come from the US, but at the same time, running a company in Boston, everyone knows, is multiple times the cost, and you have more challenges with retaining the people. Yeah. So what I think the opportunity for European companies is to pursue that hybrid model, make the tools we've all got used to working with, Zoom and Teams and whatever, work for that, and having a management team which is geographically distributed, but where you can all learn from if you've got somebody who's particularly regulatory expert who's based in the US, but the team in Europe can watch and learn and become more experienced. And I guess that's where I've been fortunate, for example, on the CFO side, doing a number of NASDAQ IPOs. Yes, you can find any number of US CFOs who know how to do the process, but actually being here in Europe and being able to help European companies onto the US markets access those US capital pools has been great.
Coming back to the sort of the COVID period and the leadership aspect, how's that impacting, if at all, on the sort of leadership qualities that people are expected to have now?
I think we've all got to be more tech savvy. It's also been helpful as a discipline for us all to rediscover or relearn old lessons that when times are difficult, you're seeing rounds of layoffs. But I remember going back, like you, probably I won't say how many years, but when investors are on strike or on hold, it's what tends to make them come back. It's self-selecting. Some companies are going to fail and wither and die. It's the ones who can be resourceful, be creative, and find ways to get through the crisis while still generating data, still showing that they're able to move programs forward.
With single asset companies, for example, can you really be creative? Will your investors allow you to be creative?
I think there's making sure and being able to demonstrate to your investors that you've really worked hard to understand what the farmers want. And farmers are notorious for sitting there and waiting to see more data and de-risk the asset. So actually understanding what do they place most value on.
If I go back in your career, Piers, I'm sorry for focusing on you, but you have this immense wealth of knowledge and experience of seeing, 5 IPOs, as I said earlier, and how companies survive and grow. Compared to, if we were having this discussion 5 years ago compared to now, what would have changed in between?
The data isn't always going to be as good as you'd like it to be. So have plan B, plan C, plan D in the back pocket. So I think that's one area. I think the second area is, again, just keep up the BD work, keep thinking about the commercial positioning, particularly as there are more and more biotech companies in our ecosystem. That's great, but it's also going to mean that you're going to get more challenges about how does your product fit against rather than 3 others being developed, maybe it's 30 others being developed. One of the questions I try to get in early is to make sure the clinical team is designing the trial with an investor as well as a clinical and regulatory lens on it.
Good times will never continue to be good. There's always going to be periods when actually there's not a lot happening, and keeping people motivated during that time, it can be quite tough.
There's been a lot of work over years of I hadn't been aware of it until quite recently. Ethnobotanists will go and spend a few weeks, a few months, maybe even a year living with a tribe understanding how they interact with the local flora and fauna, documenting that. I think one of the opportunities now for AI is to start crawling through that database.
It's amazing how things go in cycles.
Yeah. Plants are fantastic chemistry engines. And so one of the other interesting areas that Pangea is also looking at, I'm sure a lot of other people are, is it can be very difficult to manufacture those compounds at a significant yield. One of the things I've seen historically with supplements is, they may have some great molecules in there, but are they therapeutically relevant?